From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, everyone. It is Thursday, May 12th. I'm Jessica Lovell, and for Alexis Del Cid. Welcome to All Things Heart. Here is what we are talking about today.
At the time that it happened, I thought that it was probably the worst thing that ever happened to me. But as it turns out, it was one of the best things that ever happened to me.
After a stroke and multiple surgeries, Terry thought he'd seen it all, but he wasn't done yet. The heart issue that caused all of his teeth to be removed. You've likely seen them all across town, the Parade of Hearts. We find out how these incredible designs will make a difference for our heart patients. Plus, behind the mask, doctors, they are real people too. See how our team spends their time outside of the hospital walls. As always, if you have questions or a comment, you can share those on our Facebook or YouTube channel, or you can email us at allthingsheart@kumc.edu. Did you know your teeth play a huge role in your heart health? Terry Vare's history of health issues sparked the need for a new team, his dentist and his cardiologist.
It's very functional. There's also not a pickle jar in the world that I can't open.
Despite everything that life's thrown at Terry Vare, he's still a pretty good sport.
See, it's got a little charging port right here.
In 2007, a blood clot landed the Warrensburg man in the hospital where he had a stroke, followed by 5 surgeries.
The 4th surgery was when they amputated my hand. 5th surgery, I was nearly healed up and they were fitting me for a prosthetic hand. And they discovered that I still had about an inch too long on my ulna. So they went back in and whacked another inch off.
But Terry got through it and went back to doing what he loves, teaching gardening to 4th graders. As the years went on, life was going relatively smoothly. Then 2020 hit, a doozy for all of us, but for Terry it also included rotator cuff surgery, followed by surgery to remove a growth on his prostate just 10 days later, and then in 2021...
And then I had my teeth removed.
All of them?
Yeah.
Yes, you heard that correctly. He had to have all his teeth removed. Teeth are living bones, and the blood supplied to those bones was so diminished from that blood clot in 2007, Terry's teeth had all started to die. Enter dentist Dr. Maria Berrigan.
What a sweetheart and what a great, great dentist. She just did a bang-up job.
But before the University of Kansas Health System dentist would even touch Terry's teeth, Dr. Berrigan needed to do something crucial that she often does with her dental patients: consult and work in tandem with their cardiologist. Because she says gum disease and other dental problems often go hand in hand with serious heart problems.
And to learn more about this very interesting topic, we want to welcome our guest this morning in studio. We have cardiologist Dr. Seth Sheldon. How are you today?
Great. How are you doing?
Good. Good to have you. Joining us virtually is dental surgeon Dr. Maria Berrigan. Good morning to you.
Hello. Good morning. How are you?
Very, very good. We were hoping to have Terry join us. He woke up a little under the weather today, so his throat's kind of bothering him and his voice. So, but we're going to talk all about him and use his story to really dive into this topic and learn more and how it can benefit all of us. So, Dr. Berrigan, I want to start with you. Is it typical to see patients that need dental work who also have heart issues? How common is that?
Yeah, actually, it is very common to see patients that have heart conditions having periodontal disease or any other bad teeth. 99% of our heart patients at the University of Kansas has periodontal disease. And if you look into the private practice, the majority of the people that comes with severe problems of periodontal disease will have comorbidities, which one will be having heart problems. So it is very common to see both of them.
So Dr.
together.
Sheldon, Dr. Sheldon, do patients with heart issues usually have poor dental health, vice versa? What do you see with your patients?
Certainly a subset of patients can have dental disease coexisting with heart abnormalities. Within my area of expertise, which is electrical heart disease, certainly it's important for us to screen for the presence of poor dentition and dental problems, just because the devices that we put in are oftentimes inside the bloodstream, and so they're exposed to bacteria and other things that can happen from poor teeth. And so for that reason, it's important that we screen these patients and look for how their dental health is and whether they're getting regular follow-up. For other areas, when people have gum disease and inflammation within their mouth, it can affect the health of the lining of the blood vessels. And so that's where a lot of the correlation exists. So when you get inflammation or irritation within the teeth, it creates irritation within the bloodstream as well, and it can make the heart more prone to clots and damage the blood vessels that supply the heart.
Gosh, one of those, who knew? I mean,
Yeah.
we always learn at an early age to take care of your teeth, and I was fighting with my kids to get them to brush their teeth this morning, and you never realize how deep those issues can go later on in life. You mentioned the devices. Talk a little bit more about that, how that can affect them. You said that bacteria can get in there and then affect the treatment that you're trying to help provide when it comes to heart health.
Indeed. So whenever we put any prosthetic or external material within the heart, we want to make sure that that material stays healthy and we don't have to go back in there and try to do any further procedures to address that in the future. And in this situation, if somebody has an infection within their teeth and it spreads to the bloodstream, even just transiently when they're brushing or doing things and irritating that area, there's a chance it could seed or kind of attach to the external tissue that's within the heart, whether it be a pacemaker or a valve replacement or closure of a hole within the heart, and infect that area and then require a repeat procedure to take it out, which can be very complicated the longer it's been in.
Dr. Berrigan, I wanted to ask Terry how he's doing now, so I'm going to ask you how he's doing now and also what he was going through when you first met him as a patient.
Yeah, well, like Dr. said and mentioned, periodontal disease is an inflammatory disease and it's chronic. So it could be there for years. Patient doesn't even have to have pain or feel this disease, but it's chronic. So what happened with Terry is that his gums were so inflamed that was destroying the bone. Bacteria was living underneath his gums, like what can we see on this x-ray? You can see that the teeth are kind of looking like there's no support. There's no bone supporting his teeth any longer. So even though he didn't have any pain or any bleeding, the teeth were holding an incredible amount of bacteria that just by brushing his teeth or flossing can dislodge that bacteria into his bloodstream. So he was in general feeling sick. So we extracted all his teeth, and it was a process because it's also a psychological process. You're gonna lose all your teeth, and nobody wants to be with no teeth. So we went through the surgery. Terry did wonderful through the surgery. We were there together for a long time, and then we fabricated his dentures. That he's really getting used to them. He's working really hard to make them feel better every day, and he's very functional with them. So we wanted him to feel comfortable and looking good, but we also want him, the most important thing, to be functional, that he can eat, that he can communicate, that he can feel better. And he feels a lot better than before after the whole process was performed.
I bet. So back to something you said, if he's not feeling pain, did he come to you for some other reason and you realized that he had this issue? How would someone know that they needed to come see you as a good starting point?
So patients that do not go to the dentist in a regular basis, sometimes their physicians are going to be referring them to us. People have to understand that your health starts with your oral health. So you don't have to feel pain, or you don't have to have any bleeding in your gums to have a disease. Periodontal disease is not only because you don't brush your teeth, it's genetic components. is other factors that affect the periodontal disease. So people can have it for years. So some of the cardiac patients are referred by the cardiologist for the exams pre-treatments. Other patients, for example, that start having pain and have blood thinners for a long time, they have to be referred by their cardiologist as well, because we have to take in consideration those blood thinners when we do the dental treatments. So they come to us referred from their physicians. Patients should go to the dentist every 6 months. That would be great, so we can control their periodontal disease, treat it, and then decrease the outcomes on their cardiac and their overall health.
Dr. Sheldon, I know you didn't treat Terry, but it kind of goes back to what you said. So you would notice that in a cardiology appointment, and then you would refer them if you thought they had some further issues, so that could help you better know how to treat and handle your patient on your end.
Yeah, I usually just ask a simple screening question. Do you get regular dental care? Before I think about putting a device in place. And then I ask if you're having any problems with your teeth is a follow-up question. And that can be just a simple screening to see if we need to refer them on to get further evaluation.
I want to ask both of you, but I'll start with you, Dr. Sheldon. Connections between gum disease or tooth loss have higher rates of heart attack or stroke. Why is that? What do you know about that?
I think it goes back to the inflammatory state that Dr. Berrigan was speaking about. Whenever there's inflammation within the teeth, it also leads to a systemic inflammatory state. And this type of inflammatory state is just not healthy for the body, and it's also not healthy for the lining of the blood vessels. And it makes it more prone to have a little tear in the blood vessel and then a potential clot forming or blockage within the heart. And these things just lead to downstream consequences.
Dr. Berrigan, your thoughts on that for people with other dental issues, what they need to be aware of?
Yeah, absolutely. What Dr. said is perfect explanation of what could happen. Talking about an extraction, when we are going to do an extraction, which is a small surgery, we're going to create some clotting, some endothelial cells moving into the bloodstream, and that can dislodge some clots closer to the heart. There's some studies showing that they can even create a little ischemic portion into the heart. That means that it's not like you can create like a stop of the tissue's health on the heart. So you can be at. It's not that the extraction is creating the heart problem, but it's kind of like triggering something that is in there already. That's why it's so important that we can treat teeth before something happens.
I want to get to some community questions, and I'm sure I'll have a few others I'm going to throw in there along the way. But Brad has a question. I have gingivitis. Am I more likely to have a heart attack? Should I be doing additional tests to make sure I have a healthy heart?
So it's a great question, and I think first question would be, do you have any heart-related symptoms? And certainly if you have heart-related symptoms, it would be warranted to speak to your primary care physician and potentially seek a referral to a heart expert to just dive into that issue further. Otherwise, good health prevention is really important. So making sure we maintain our body weight, we don't smoke, which is really important to the blood vessels that supply the heart. Make sure that we diagnose and treat any elevated blood pressure issues, as well as assessing the cholesterol. And all these things kind of go together with the whole prevention strategy.
Dr. Berrigan, how do you make that connection with gingivitis? And maybe we start with that. How do you get rid of that?
Well, gingivitis, we can treat very easily just by brushing, flossing, go to the dentist every 6 months. Gingivitis is reversible, and it's not something that stays there chronically. You also have to see comorbidities, diabetes, high blood pressure. You have to control all that with your gingivitis control too.
Lauren has a question. I brush my teeth twice a day, but I rarely floss. I'm sure you hear that sometimes, doctor. What do dentists mean when they say keep up good dental habits, and why you can't just practice one dental habit? You have to practice them all, including getting to the dentist twice a year.
Right. Well, flossing is very important because it's going to remove the plaque in between your teeth. The spaces in between your teeth are sometimes the initiation of cavities. So cavities can start in between your teeth. That is so important that you can floss and you remove all the plaque in between the teeth. So flossing and brushing together is going to protect you from having gingivitis.
So Ann wants to know, she's asking how often should you see your dentist? That's not changed. No new recommendations. It's still twice a year as it's always been, right?
Twice a year, correct.
Okay, that's pretty easy to remember. Let me see. I do have a question, kind of a long question, so I'm going to read it, doctor, and see what your thoughts are. This person had shoulder surgery back in 2019, then had a bypass heart surgery, and then 2021 had a prolapse surgery. This year, this person's been dealing with tooth problems, teeth going bad, even under existing crowns. Been to the dentist about 20 times this year, and they said it might be connected to medication for the heart, which can dry out the mouth and then cause that problem with the teeth. What are your thoughts on that, and what should this person do? Any recommendations?
Absolutely. Dry mouth is going to be our biggest enemy. And the reason for that is because, again, if you think about the sources of inflammation, which is bacteria, saliva is going to be helping to wash off that bacteria. It's our first immune ways or systems that our body is going to use to defend from bacteria. So when you have dry mouth, you don't have that saliva to help you flush it out. And that increases decay, increases inflammation, increases amount of bacteria in your mouth. So you have to be very hydrated all the time. You have to people can use rinses without alcohol, so it will not dry off more their mouth. So yeah, dry mouth is a very, very important aspect on how we have to continue to prevent periodontal disease and decay.
Charlie wants to know, we talked about bloodstream issues with bad teeth, but what other issues can not taking care of your dental health cause other than heart? Do we know what else we should be looking out for? Any signs, any other parts of the body or organs? Well,
there's some studies showing that you can have oral bacteria found in your kidneys, in your lungs, everywhere. Sometimes you can have aspiration pneumonia. Patients come back with aspiration pneumonia and they don't get any better. And then we find out that their teeth were not very well taken care of, and the bacteria that is in your mouth can affect how well you're gonna heal from infection. So I think teeth are very important in terms of infection control. So it does affect other parts of your body other than your heart.
Mike wants to know, which are the most important teeth to take care of? I know your answer is all of them, but are there more teeth to be looking out for? Any discoloration, any pain? Is there a part of the mouth that we should really be focused on and really pay attention to?
It's really all of them. You can have an abscess tooth in any tooth, and that can create troubles. Anterior teeth, posterior teeth, you have to clean them, brush them. If you start having pain or inflammation or swollenness or bleeding, you have to go to your dentist immediately to take care of it.
All right, I'm going to, we asked about this a little bit earlier, Dr. Sheldon, but Kelly's asking, is it common for your dentist to work with your cardiologist? Should I be asking my dentist to do this if they aren't already? We don't want to alarm people. It may be a rare instance where your cardiology team is now, hooking up with your dental team, right? But
we probably work together more than people realize. That can be as simple as just kind of clarifying medications and what to do going into a dental surgery, and what to do with blood thinners and antiplatelet agents and everything beforehand. In addition, a dentist usually asks about what other health conditions are present, and there's sometimes a discussion that we have with our dental colleagues to try to make sure that we deliver the best possible care for our patients.
Yeah, you're right. I think that is interesting that people don't think that. But then
Yeah.
you can find there might be a bigger issue that you have to deal with once you kind of uncover some of those initial screenings. So let's talk about our patient just before we get to some final thoughts. I wanted to ask you, Dr. Berrigan, so what's next? Is he all in the clear? He's got new teeth. He's probably smiling and happy now, healthy. Any checkups he'll have to do? Any lifelong things that he'll have to be taking into consideration?
Well, yeah, he will have to be checking with us periodically. Once people don't have teeth and you have dentures, you're gonna have a continued bone loss that will eventually create that the dentures are feeling loose with time. So yeah, he can visit every 2 years, not every 6 months anymore, but every 2 years, so we make sure that the dentures are not ill-fitting and they're not hurting his gums. We also have to check on oral cancers, so it will be good to keep going to the dentist at least every year, every 2 years for patients that are completely edentulous with no teeth.
I know Terry's case was pretty severe. Is extraction or a full extraction the only way to go? Is there any way to reverse this? Any medication you could put someone on?
Unfortunately, the bone loss cannot be reversed. Patients that do not have cardiac problems or do not have the problems that Terry had can have periodontal treatment. We can treat them. They will have to come every 3 months for perio maintenance. So we can treat them. The bone loss, we cannot treat it anymore. But the patients can keep their teeth in different circumstances that are not affecting their overall health with the appropriate periodontal treatment. So not everybody needs to have all their teeth extracted.
Okay, good to know. Angela wants to know, do hormones affect teeth?
Yes, I believe so. And not necessarily the teeth, but the periodontal, the tissues around them. Some, especially a woman, when they have different hormonal changes, they can have bleeding in their gums. So there is a change on their environment. It's not the tooth per se, but the whole tissues around the teeth. Yes.
Very interesting conversation. Learn something new every day here. Let's get to our final thoughts. Dr. Sheldon, I'll start with you. Just in general, what do you want us to know? It's called All Things Heart, so just give us some really good heart health advice that you want us to take away today.
One thing I've been thinking about just listening to Dr. Berrigan speak and everything is, we know what we need to do as patients, taking care of our teeth and brushing our teeth and flossing. And I haven't always been the best at that, to be honest. And I've worked at that the last 6 months, but particularly with the flossing. But access to care is a big thing for a lot of people too. And not everybody has the resources or the availability of knowing where to go to get regular dental care. And we see some of these same socioeconomic factors correlate with adverse health otherwise, whether it be heart or other organs within the body. So maybe with our link to this on YouTube or something, we can put some sort of resource for people to access for getting routine dental care.
Absolutely, you nailed it, because that's really what it's all. We're not all, not all situations are created equal, and it's not a matter of just pushing off the dentist and not going because you don't feel like it. Some people just simply don't know how. They weren't brought up with dental care. And so really important that you brought that up, Dr. Sheldon. Thank you so much. We're going to have some fun with you here in just a moment, so hold on just a second. Dr. Berrigan, just your parting advice for us today, final thoughts on how we can avoid being in a situation like our patient Terry.
Yeah, well, for me, the oral health is very important on the general well-being of the patients. And that's the reason why the University of Kansas has a dental department, and we have a clinic where we can treat everybody. So they can come to us for treatment. We can sometimes refer them to clinics that are available for patients that have no means or no insurance to go to the dentist. So we're here to help everybody, for sure.
Thank you for the work you're doing. Thank you, Doc, for the work you're doing as well. We appreciate this conversation. Very important. Well, one of the great things about working here is getting to know our healthcare workers, our docs, our nurses, all behind the mask, learning what makes them tick, in real life. You may remember Dr. Sheldon, kind of a true outdoorsman. Here he is. Let's take a look. Okay, there he is. Okay, so tell us a little bit about, we got some pictures, you and your family taking some bike rides. I think we have some of you up in Chicago. That's not Chicago, I know that.
That'd be probably somewhere near Aspen, yes. Crested Butte for that one.
You go paddle boarding, you do all this with your wife, Kate, and your 3 daughters, Flora, Claire, and Olivia. You make it kind of a family affair. What do you guys love doing? You know, why is this so important? I'm sure when you get away from the hospital to get out there and do this.
Well, things are busy in the hospital, and I think it's really important for providers to have an opportunity to recharge, to be able to deliver the best possible care when they're back in the hospital. And so for me in particular, I really enjoy family time, and I really enjoy the opportunity to get outside and be active, and it just helps me feel better and manages stress, and it's really a fun activity.
So you're saying doctors have to have self-care too, right?
A little bit at least.
A little
yes.
bit, yeah, when you
Yes.
can sneak in the time for
Yep.
sure. All right, Dr. Berrigan, it's time for you now. You're quite the traveler. We have some pictures of you and your family. You actually went to Chicago, and you guys like to bike and get out there. You guys like to go snorkeling as well. We're going to run through some pictures here, but what do you guys like to do? What's the thing how do you connect? How do you unwind? And how do you make sure you come back rested to your patients?
Well, like you said, we have to take care of ourselves so we can take care of other people. I like to be outdoors with my children, my 2 daughters and my son. And every chance that we have, we like to travel. We like to see other places, meet other people, eat different food. We love to travel. That's kind of like our favorite thing to do. And that's why we try to do all the time.
Where was one of your favorite places to go?
Actually, Chicago is a very nice city there. We're gonna go to New York and here in the summer. So we like to, I like my children to see different places and the culture, and we like to go to museums and walk outdoors. We like everything.
Good for you. Well, thank you for sharing, both of you, sharing a little bit of behind the mask, what you and your families like to do, and get out there and kind of recharge the batteries. Well, you have most likely seen them all across town, the Parade of Hearts, 154 hearts designed by artists across the region, including some artists who happen to also work here at the University of Kansas Health System. Next month, each of these giant hearts will be auctioned off to the highest bidder, and some of that money will benefit the cardio program here at the health system. We spoke with the chair of cardiology, Dr. Mark Wiley, about what an honor that is for the health system and how the money will help heart patients here.
We're very excited and honored to be a part of the whole Parade of Hearts movement initiative. We're committed to adding advanced imaging equipment to help support some of our key programs.
Well, we take a look exactly where that money is going and what programs it will help. That will be next week on All Things Heart. And thank you so much for being with us today. Also next week on the program.
Essentially, what they've determined is that my jaw is not sitting in the right position.
We'll tell you how this before and after saved this man's heart. We answer that and more on the importance of a good night's rest. That's next Thursday at 10. Bring your questions. We'll see you then.